My name's Derek Bickerstaff. I'm the chairman of the One Health Group. One Health Group is an organisation that provides medical services to the National Health Service. Specifically, we do elective surgery, that's like hip replacements and knee replacements for the NHS. We have a national contract, so we can see patients referred to us from any GP within England. The unique thing about One Health, though, is that we provide these services out in the community. So we don't work in the ivory tower hospitals. We get our subspecialist surgeons, we take them out into the community where they see the patient, they do the diagnostics and the rehabilitation. And if they need an operation, then we work out of 12 surgical facilities. So One Health has always had very strong organic growth, double-digit organic growth, really since its inception. We work presently in the north of England and the Midlands, and we're constantly growing our geographical area. So our plan in the longer term is to grow a network of these surgical facilities, again, treating the more underprivileged areas in the country. We had an IPO in March, so we've been on AIM now for a year. The primary aim was to get funds to build our first surgical hub, which we succeeded. We raised 7.8 million. The NHS is very highly regulated, quite rightly so, because you don't want people just providing services clearly without any regulation. Being a listed company, we have additional financial regulations and clinical governance regulations. So this is very important for our credibility, if you like, to the wider NHS and to the wider stakeholders who all interact with the NHS. This government's ambition is to get waiting lists down to around about 3 million by 2029. So that means they need to take off 3 to 4 million people off the waiting list, which is an enormous task. And we're convinced that the independent sector, particularly groups like ours, where we work solely with the NHS, will be able to get them to achieve that target, with the principle always of all care is free at the point of delivery, which is what we provide.